with the pandemic going on, we've introduced a Kingsley Safe Stay program to kind of give reassurance to families what we're doing to make our homes as safe an environment as possible. Can you tell us what you've been doing at Four Oaks? Because I gather, I mean, you've stayed COVID-free throughout the entire pandemic, haven't you?
That's correct. Yes, we have. We've been one of the lucky ones, should we say, that we have managed to avoid the coronavirus. Our measures are still in place, just in case, because we are dealing with a global pandemic here. But we've been very lucky to say that yes, we have managed to avoid the coronavirus thus far. We've been working with many individuals, such as the Public Health England, with our local council, with the CCGs and with the infection control team, to make sure that the steps that we're taking to keep this virus at bay is the best practice, and that we're delivering the right training for all our staff, because it's important that our staff have the right training in order to deal with pandemic situations like we're in at the moment. We've accessed formal training through the infection control team. Some of this involves with dealing with dossing and doffing of PPE, which is one of the things that I've said is one of the key protection measures for this pandemic, is being able to put on your PPE properly and also being able to take it off. So we've accessed this training that they've rolled out, which is NHS accredited training, for all our staff to start using these basic principles for using for the PPE purposes. We've put in some strict cleaning regimes to make sure that our home's nice and clean, that if there is any potential for the virus getting in, that we're stopping it before it gets to our most vulnerable people, which is the residents. They're paramount in in all this pandemic, that we need to make sure that they're protected, as well as our staff. We have some staff that are in the vulnerable category that we've got a duty of care to protect them as well. So we've been making sure that we've got a robust cleaning regime, which includes things like 2-hourly deep clean of our communal areas, because I believe that that's where it's going to come in. That's where the entry point is. And if we can ensure that we keep this area clean, then it prevents it, or reduces the risk at least, of it getting down onto the units where our most vulnerable categories are going to be cared for. We've got access to appropriate cleaning products as well, the right cleaning products, to make sure that we keep on top of this virus. We've had advice from the infection control team, obviously from head office as well. They gave us advice on what's the best cleaning products to use. And we've got a full range of it, and we've got plenty of access to it all, to make sure that we're using all these cleaning materials to keep on top of it.
And everything you've been doing has been, you've been given CQC's just done a report for you, hasn't it? And has given you the reassurance that everything you've done is the best way forward.
Absolutely, yeah. CQC have been rolling out what's called an emergency support framework. And this is in the absence of doing actual visits during the pandemic. So as part of this, they've been speaking to home managers, finding out what their steps have been to protect residents, to protect staff, in order to keep this pandemic at bay. We had ours 2 weeks ago, and I must admit the report was very reassuring. It was very positive, and it definitely guided us on the right steps to say that we're doing the right thing at the moment. They've said that we are dealing with the pandemic effectively. And the proof is in the pudding. We've done mass testing, we've done testing for all the residents, all the staff, and every single one of them have come back negative. So we've been able to prove our case that we've been doing the right thing. We've managed to keep this virus at bay. And like I say, CQC have been able to reassure us that we've been handling this pandemic effectively. So we're very pleased there. I must admit, we are very pleased there at Four Oaks. So
that's brilliant. How have you managed to keep the residents sort of happy and content throughout this bit? Because obviously it's very difficult for them not being able to have family visits.
Yeah, absolutely. Yeah, it's been very testing times for the residents. We're used to having visitors on a daily basis, sometimes, multiple times throughout the day. And it's a big loss for the residents, and it's a loss for us because they become part of our family too. We see these people on a regular basis, that see them probably more often than some of our own families. So when we don't see these people, we do miss it, and we understand that the residents miss that too. So we've been operating with a lot of technology, basically, with Skype, with Zoom, with Facebook Portal. The company has been giving us these resources so we can access these for family members. And we've been scheduling 4 times a week now, regular sessions where people can do these video calls so they can make contact with their family members. And I must admit, the feedback that we've received has been extremely positive. We've been inundated with emails from family members to thank us for all that we're doing to maintain them communications, and obviously how well that we're doing within the home. They can see through the residents' well-being that, we're doing everything that we can to keep, obviously, spirits as high as we possibly can, given, obviously, these very testing times. And what we have recognised is that with the measures that we've put in place, that these are good practice measures, and they've improved our practice, and these are going to be here for the long term. So even when pandemic's under control and we're out of isolation, I honestly do believe that we will continue with maintaining these communications of doing video calls with family members, because we see the importance of it, and we see, obviously, the benefits from the residents' well-being of doing these regular communications with them. So it's been a very positive step forward doing these video calls.
In terms of entertainment, because obviously you normally have a lot of entertainers come in the home, has your activities team managed to keep things going, to keep the residents happy and entertained?
Absolutely, yeah. I mean, again, with technology, we've been very lucky that we've been able to utilise the technology to our advantage. So we've still been able to access entertainers to come into the home. Behind me, you'll probably see that we've got a gazebo there, and this is set up purposely for entertainers to come and sing in the gardens. The residents can come and enjoy the entertainment within our sunroom, and we've had regular scheduled entertainers coming now every week. And we've started now doing live recordings of this as well through Zoom, where family members can join in through the Zoom links for the entertainment. So it kind of brings the whole community together, really, doing these activities. We've also been considering doing other live activities, not just for the entertainment that's coming through, but say, for instance, when we're doing bingo or when we're doing arts and crafts, we're now starting, moving forward, doing live streaming of these activities. So again, family members can get involved and do some of the projects with us. Also, with the local council, they've been sending us updates of other events that's been going on in the community, of other activities. So, for instance, there is a lady called Danielle who's been doing Zumba through Zoom, that we can tap into, so our residents can get involved with other activities that are going on interactively in the wider community. So it's networking with other care homes and other activities that are available out there. So it's been really important to try and increase our activity support to improve the well-being of the residents, and it's been really well received. It's gone really well.
Keane, I was going to say, you're obviously, it's a difficult time for families. They're very anxious about their loved ones coming into care homes, but you are very much open for business, aren't you?
Absolutely.
And although families can't come into the homes at the moment to have a look round, you've got a virtual tour that you can send people a video link.
Yeah, absolutely. I mean, we all see the news. We all see, what's going on at the moment, and there does seem to be a lot of scrutiny at the moment as far as care homes is concerned. Now, I'm living proof here that I'm running a care home, and I can see that this care home is safe. I have no concerns here. The council, the local council, have no concerns, and they see that the home is safe. The CQC report again evidences that this home is safe. So there is no reason why we can't take admissions here, you know, and we can deliver, you know, we can deliver this safe stay that Kingsley is operating with at the moment. And we more than welcome people to come forward, come and access a virtual tour that's available, you know, generally Monday to Friday, but we can arrange it during the weekends as well if need be. And we welcome people to come and see what we're doing at this home, and, you know, consider bringing your loved ones here, because we will look after, you know, we will look after your residents. And if there's anything that we can do to make the stay more comfortable, then we're more than open to suggestions. But yes, we are definitely open for business.
That's brilliant. Well, thanks for talking to me, King.